MD Medicine is a global network of healthcare providers establishing a quality standard, cost-effective, patient-centered, physician-oriented health management system. MD Medicine Health Management System is a comprehensive system emphasizing preventative care by encouraging regular checkups, vaccinations, and health screening to detect disease early, saving costs associated with expensive medical treatments. It utilizes a system wherein patients select a primary care physician, PCP, as their direct contact for medical needs. The PCP oversees the patient's healthcare, coordinates specialist referrals, and ensures continuity of care. The PCP is a central point of contact, ensuring the patient's MD Medicine medical records are centralized, tests and treatments are appropriate, and necessary follow-up care is arranged. A component of the MD Medicine healthcare system is the Prepaid medical package scheme, which involves paying a fixed amount upfront for a specified service. It enables individuals to access various medical services without worrying about unexpected costs. These packages often include healthcare options such as doctor consultations, diagnostic tests, and even hospitalization services. It offers a comprehensive and affordable alternative to the fee-for-service system. It allows individuals to plan and budget their healthcare expenditures and removes the need for insurance approvals, long waiting periods, and complicated reimbursement processes. MD Medicine offers an online physician appointment system that is convenient for patients and physicians, which resonates particularly well with individuals with work commitments or mobility issues. Physicians optimize their schedules and allocate more time to patient interactions by streamlining appointment bookings through the virtual MD Medicine platform, translating into potential cost savings for patients. Additionally, and for complicated medical cases, the MD Medicine physician-to-physician online medical second opinion holds immense potential in revolutionizing healthcare collaboration and improving patient outcomes. The MD Medicine physician-to-physician online medical second opinion refers to the process where physicians virtually consult their peers from different geographic locations to seek additional expertise or confirmation regarding a patient's diagnosis or proposed treatment plan, improving diagnosis and treatment planning accuracy. It bridges the gap between general practitioners and specialists, allowing for seamless collaboration. For multi-system disease, several specialists could be consulted simultaneously for a group consultation to offer their expertise, improving patient outcomes. In addition, its electronic medical record component provides secure channels for sharing medical records, lab results, and images, enabling healthcare professionals to make informed decisions. Finally, MD Medicine health professionals interested in pursuing their careers in different environments will have the opportunity to be approached for job offers from international healthcare systems through the MD Medicine job matching program. MD Medicine, and through its affiliate recruiters, recruits qualified hospital staff by applying a comprehensive process to ensure the candidate's suitability for the position they are applying for. On the business side, MD Medicine aims to generate a patient load for its member physicians through conventional and digital marketing strategies, including the MD Medicine social media channels. MD Medicine is a recognized sign of a quality standard, cost-effective, patient-centered, physician-oriented health management system.